We would like to have a discussion with Dr. Sharad KR from Fracture and Ortho Clinic with regards to this new procedure that has been going around called the direct anterior approach.
Okay.
So, sir, what are your thoughts about the direct anterior approach? What is it? What is direct anterior approach?
Direct anterior approach is a procedure where hip replacement is done from front of the thigh compared to the traditionally which is being done from the back of the gluteal area where the buttocks or the back. So it's called direct, means direct. We are seeing the hip from front. Anterior is front, hip replacement. Yeah.
So, what is the difference, sir, from the traditional approach? What was happening previously, and what are the changes now?
As you can see, this is a hip joint seen from the front, how it looks like that from the front. Traditionally, we are doing hip replacement from behind. All the soft tissues, capsules, muscles around the hip joint, we used to elevate and then we reattach it. It would heal with time, and then still there will be slight weakness of the back of the hip joint. This weakness usually will not cause any problem. Some rare circumstances where person wants to sit on the floor crossed leg, squat, some extremes of hip movement, there is a possibility that on some moment this implant might come out like this. This is called dislocation. Not very commonly seen even with the posterior approach. However, because we were removing the muscles, elevating the muscles, reattaching it, all this requires muscle resection, reattachment. Here now, compared to that, this is a hip joint seen from the front. We are going to separate the muscles, not cut. We don't cut the muscles. There is something called intermuscular internervous plane. Means we separate two muscles, we go to the hip joint, we do hip replacement, then just fix the muscles back. In this procedure, muscle damage is very much less, and as back of the hip is not disturbed, the chances of this hip going in for dislocation is absolutely, as I have to say, it is
Close to zero.
Close to zero, but extremes of some movement, someone doing some odd movement, some falls or some injuries are not in our control. However, if implants are positioned perfectly and surgery is done nicely, then should be very good results.
So, who are the patients who should be considering this? Who is it done for?
Yeah, this is very important question. There are so many people who require hip replacement for different various situations. Unlike knee replacement is commonly seen for osteoarthritis and rheumatoid arthritis commonly. Whereas a special class of people in the hip called post-traumatic arthritis, where there will be previous surgery around the socket, plates and screws. There will be someone with a childhood dislocation that is called as dysplastic hip. These are the complex kind of hip replacements which are not very much suitable for direct anterior approach. They are handled better off with the traditional approach. However, commonly seen hip arthritic conditions like avascular necrosis and rheumatoid arthritis, these are commonly seen conditions, or primary osteoarthritis. These are the commonly seen arthritic conditions of hip where there are no implants around, there are no previous surgeries, there is no childhood problem. These are the patients who are ideal for undergoing this direct anterior hip replacement.
So now, sir, how is it better for the patient? How does the patient feel a difference from doing traditional to direct anterior?
See, when we do direct anterior, patient will be lying supine on the operation theatre table. like patient is lying supine. When we do traditional, patient will be lying on his side, where operating hip is on the up top. Whenever someone lies supine, if there is any anesthesia changes to be done, any medicine has to be given, and person for himself to lie down supine and surgery is happening, is very comfortable for patient, also for anesthetist. For example, someone has to be lie down on the side for 2 hours, 1.5 hours. Anesthesia point of view advantages. For us to assess the leg length, when we do hip replacement, commonly we encounter some variations in the leg length of the new joint which we have implanted. That leg length adjustment during operation and on the operation theatre is better off when person is lying down supine. We can compare left and right there only, and we can change it. And when we have to see X-ray, it is very easy to see X-ray of the operation theatre. Patient is lying, if patient is lying down supine. These are the advantages for us. The important advantage for the patient is that since we are not cutting the muscles, they will not have that much pain as compared to the pain which we see when we cut the muscles.
So pain will be less, recovery will
be faster. And
post-operatively also, sir, if a patient had gotten traditional hip replacement, will he have more movements or will he be able to do more because of the direct anterior approach?
Post-operative movements depends on each individual's pain perception, pain tolerance, and what is the muscle strength of each individual. There is no specific advantage objectively. However, definitely if it is done well, there are advantages of all these things what we discussed. Surgical incision is very small. Person's cosmetic acceptance is better. However, we are not saying that the traditional hip replacement people are limited in any ways. We are anyways doing that. But then adding this to our armamentarium helps us to cater to different needs. And as these days some youngsters are coming after the COVID, they would like to go for marathon, badminton, swimming, cycling. So we, without any hesitation, we can ask them to go for sports and those things. With advanced implants and advanced surgeries.
Yes, sir. Now also with AVN increasing, sir.
I
think that is the main patient group that is
the main patient group coming for hip replacements.
For them, I think direct anterior is the best.
Is the best for AVN, yes. Also, with that, adding robotic is also an advantage.
So robotic also
with the direct anterior, yes. Robotic hip replacement with direct anterior is even
greater accuracy.
One step advanced.
So that also can be added to this procedure.
Yes, absolutely. Robotic can be done with posterior also,
yes,
the anterior.
But even
with the anterior, if we are adding robotic, it is even better. We have covered most of the questions commonly asked by the people. So in next video, shall we talk about more in detail about the approach and other things?
We'll further discuss into if any other questions that are coming in the comments. We can obviously.
We will request our viewers to put questions in the chat box. We will get back to them.
Because it's a new topic and there's not much awareness, and Dr. Sharath has been practicing it and it has been showing wonderful results to especially young patients with AVN and such.
Yes.
So there should be some awareness regarding that. And if you have any doubts, please feel free to ask, and we will make another video to clear all those doubts.
Thank you.
Thank you.
Thank you, Dr. Yeah, thank you.